I'm Dr. Vince Bellonzi, and I wanted to make this video. Just was reading some research on what's called endovascular treatments, and there's a lot of things that doctors are trying to do to help prevent strokes and heart attacks, the damage that occurs once an event has happened. And they have what are called endovascular treatments. In the past, they had balloon angioplasty. Now they've got some newer methods, but it seems that none of these methods are working very well. The research says that the results wasn't any better than just using some of the drugs that they use to break up clots and thin blood. So unfortunately, these procedures that they've come up with aren't very effective, especially after a certain amount of time has passed. So you have to get in there, and the drug is really the most effective thing. So unfortunately, there isn't a good endovascular treatment that they've come up with yet. When they did balloon angioplasty and when they do this other treatment, they try to go in, they snake something up the artery and try to open it up with some kind of a device. The problem is that can often cause damage and the artery can close down again. So hopefully there will be a treatment for after the fact sometime in the future. What I really want to talk about, though, is prevention. You hear it all the time. You know that you should eat right and exercise and do things to prevent problems, but are you really doing it? Because the real problem with heart disease and strokes and all these things that are the number one killer is the fact that it's about inflammation. It's not about cholesterol. So we have so many people on cholesterol-lowering drugs when the real problem is inflammation. Cholesterol is not really dangerous. It's something your body makes. It's very safe. The problem arises when the cholesterol is damaged. If you glycate the cholesterol, which means a sugar attaches to it, or if you oxidize the LDL, it's not bad cholesterol. It's bad when it's damaged. That LDL normally can pass in and out of the artery wall and not cause any damage. It's very safe for the body. But again, if the LDL is altered in some way by oxidation or by glycation or other processes, then you can have a problem because the LDL turns into small dense particles that are somewhat like rocks that can actually do damage to the endothelial wall, and they call it endothelial dysfunction as the inflammation proceeds. It's the inflammation that causes the high blood pressure and the blockages to form. So why don't we early on do something about that? Now there's a lot you can do. Inflammation is caused by damage to cholesterol, so don't damage your cholesterol. It's just like the food you would bring home. We have refrigerators. We do things to keep the food preserved and not let it go bad, because if you just set out many foods, they'll oxidize, they'll go rancid, and they'll actually make you sick. So we do things so that won't happen. We put them in dark bottles. We put them in the refrigerator, but it's so that food can be preserved. How many of you are thinking about preserving or keeping safe your cholesterol? You actually make an antioxidant called glutathione, and glutathione can actually protect your cholesterol, but maybe you're not making enough of it. Exercise is your number one source, because when you exercise, you make more of the antioxidants that your body produces, and those are the most potent and effective. So you can leave your cholesterol somewhat unprotected. And then if your sugar levels are going higher than they should, we know that anything over about 84 milligrams per deciliter for a fasting blood sugar means there is excess sugar around, and it's going to be there to glycate tissues, even your cholesterol. So if you've got higher blood sugar levels, you're actually, as we speak, glycating or reacting to your cholesterol and damaging it, and then it's going to be damaging to you. Are you doing things to keep free radicals down? Exercise, again, is a big thing for that. So is eating certain foods. You can protect yourself from heart disease and not have to end up going to the emergency room and hoping that you get there quick enough so they can put an anti-clot drug or something to open the artery before damage occurs. Because once blood flow stops, you're going to have damage. Whether it's in your brain and we call it a stroke, or it's in your heart, we call it an infarction. Basically, you've been not paying attention perhaps, and this damage has been ongoing. That's most of the time the case. So learn about inflammation, learn about ways of reducing inflammation, keeping your arteries safe, keeping your cholesterol safe. Because it's not about lowering cholesterol. Even statins have their best effect as an anti-inflammatory. But your lifestyle is number one. You can do so much to keep your body from being inflamed and save yourself that trip in that ambulance. I'd rather see the doctor on the golf course. Probably you would too. This is Dr. Vince Bellonzi. Learn how to live healthy. Thanks for listening.